biomedical waste. From hospital, 80% of the waste of the waste is solid, non-medical, and should be utilized with the 4 R's, including compost, bioenergy, etc. We have to deal with this 20% biomedical waste. Situation is that this waste basically has 2 uses. One, which is non-recyclable, non-reusable, that needs to be dealt with the final R, that is the reduced and terminated. And the recyclable ones are used. Now, out of the waste that we have, biomedical waste, generally 3 things belong to this category. Any sharp thing basically belongs to a recyclable thing. Any metal, glass, or implant is reusable, and any plastic is reusable. Other than that, everything is non-usable. Now the color coding: plastics are in red, sharps are in white, metals and all that are in blue, and everything else is in yellow. The yellow part can be divided into many other subcategories, but before that we must remember that their main aim is to get reduced and terminated. So for the yellow part, the final step will always be reduce them into ash, which is either incinerate them or use pyrolysis, followed by they will be incinerated or pyrolyzed. So they will be reduced, and then we will use deep burial. That is the final step. But this yellow waste can be of many types and sometimes needs pre-treatments. For example, clothes need treatment with 5% phenol or 5% cresol or 5% lysol, and then they can be reduced and disposed. If there are liquid wastes, they need to be treated with 1% hypochlorite with 30% remaining chloride with a minimum 20 minutes contact time. If there are drugs, then they can be encapsulated or inertified before they can meet the same fate. Every other yellow trash can go down this path directly. Now coming up to these three things, the red, blue and the white part, they all have one common mode of disposal: either autoclave and then shred into small pieces and then reuse them, or microwave and shred into small pieces, or directly go from this to this using a hydroclave. Red and blue meet this criteria directly. The white ones cannot be recycled most of the times, so they undergo this process and then followed by a deep burial or a sanitary landfill, etc. Also, liquids don't go this side, they are mixed to sewage. Now some extra thing. What is a deep burial? From the soil part, we have to dig 2 meters, means 200 centimeters. Till 100 we fill with waste. Till 50 we fill with lime. Then we fill with soil, and minimum 600 centimeters gap, that is from the level of 8 meters and below, there should be water. What is incineration? More than 1200 degrees C of dry heat oxidation. We all know what is autoclave is. We all know what is hydroclave. We all know what is microwave. 2450 megahertz. And a few extra points after that. Within how many hours we have to dispose every waste? 48 hours. Criteria is to meet the perfect plastic bag to contain these wastes. Non-chlorinated, minimum 50 micrometer thick. How should we transport them? Dedicated trolley system. There should be central storage areas. Is it necessary for BMW handlers to wear PPE? Yes. Where does the final step or like all this happen? Is it in the hospital? Never. It is in a place called CBM WTF. What if this facility is not available? If this CBM WTF is not available within 75 kilometers of hospital, then hospital can take charge of controlling the wastes.